joining us. I'm Nancy Aziz, and this is Healthline. Our program this evening is about a very debilitating disease that affects millions of people and their families worldwide. This disease is known as COPD, chronic obstructive pulmonary disease. It's a disease that brings with it a slow suffocation process, chronic and painful breathing patterns, as well as a feeling of complete despair. We have our top correspondents, Lorna Lynn and Risa Togle, on the scene, reporting to you live about alternative therapies and the two big players in the COPD world of emphysema and bronchitis. Our chief medical correspondent, Paulina Stiva, joining us with a riveting interview with Dr. Saab, a specialist in the world of COPD. And our very own resident nurse, Armand, will take you through a heartfelt nursing process with Mark, a patient suffering from COPD. So stay with us. We will be right back with Lorna.
Hi, Lisa. I'm
Hi.
Nurse Lorna. Nice to meet you.
Nice to meet you.
We're going to talk about the different medicines used for COPD, okay?
Okay.
So what the medicines do is reduce shortness of breath, control coughing and wheezing, and prevent COPD flare-ups. So most people with COPD take medicines to help them breathe better. One of the medications that they use are bronchodilators. They're used to open and relax your airways and help you with your shortness of breath. Short-acting bronchodilators ease your symptoms. They are considered a good first choice for treating stable COPD in persons whose symptoms come and go. Long-acting bronchodilators help prevent breathing problems. They help people whose symptoms do not go away.
Okay.
So these are the inhalers used for COPD. We
Okay.
have Atrovent, and that is a maintenance treatment. So also with Atrovent, you can use Spiriva, which is the maintenance of COPD. It opens and relaxes the airways, making it easier to breathe. So if you were to have a flare-up, you would want to use Proventil, which is a rescue inhaler. So what that's going to do is, like when you have shortness of breath, it's going to help open your airways, okay?
Okay.
And do you know how to use an inhaler?
Not really. Can you show me?
Yeah, okay, so there's one right here. So this would be a rescue inhaler. So what you're going to do is let out all the air. You're going to open it and shake. And then you're going to put it in your mouth and then inhale.
Okay.
And then hold it for 10 seconds, like so. And then let it out.
Okay.
A lot of people don't get the effect of the medicine because they don't know how to properly use it.
Okay.
And over here we have a nebulizer. Some people use this in order to help them breathe. It opens their lungs and passageways so it's easier. So what you would do, just put this on like so and then breathe in and out.
Okay.
And over here we'll just test how your peak flow is. So you're going to just, with all your mic, just blow into here, okay? See, what COPD does is it's supposed to be up here and you're breaking lows because you're not getting enough oxygen, okay?
Okay. Thanks.
You're welcome. So I've explained to you the medications used for COPD and the treatment plans with the inhaler. What you also need to focus on is your diet.
Okay.
And also you need to start exercising because exercise is going to help with your lung function. So you can do things like Tai Chi and yoga to help with opening your airway and just learning how to deep breathe to better your lung function.
Okay.
Also, you can do acupuncture. That also helps with people with shortness of breath. Okay?
Okay.
So just keep on taking the medication. You aren't going to see much of a difference within 2 weeks, but after that, it'll gradually start helping you. So just eat a healthy diet and exercise, and you should be okay. And we'll see you on your next visit, okay?
Great. Thank you.
You're welcome.
Pulmonary rehabilitation should be recommended for all clients with symptomatic COPD, which would include bronchial hygiene, exercise conditioning, breathing retraining, nutrition, and other topics such as smoking cessation, health promotion, psychological counseling, and vocational rehabilitation. Walking is the best physical exercise for the COPD client. The nurse should walk with the client, giving verbal reminders when necessary regarding breathing and steps. Walking with the client decreases anxiety and helps maintain a slow pace. It also enables the nurse to observe the client's actions and physiologic responses to the activity.
Thank you for joining us today, Dr. Saab. We are here to discuss a very serious subject which is very near to my heart. As you all know, my grandma was diagnosed with COPD not too long ago, so welcome.
Well, thank you for having me, Pauline. Yeah, I've heard about your grandmother, and let me just tell you, I'm very sorry. She's a wonderful lady.
So, can you tell me what problems do people with COPD have? What are their difficulties, and why is it so difficult to live with this?
Absolutely. The biggest symptom, of course, is dyspnea, which is difficulty breathing, shortness of breath. They also have problems with cough and sputum on a daily basis. These are really the major symptoms. They also tend to fatigue easier. They are tired, run out of energy, and then more advanced cases develop. Weight loss, they also become more prone to respiratory infections, and they get these episodes known as exacerbations.
So, are they more prone to pneumonia?
Yes, absolutely. They also get more bronchitis attacks. They experience on a daily basis shortness of breath, cough, and sputum. So, of course, this would lead to a more serious promo of pneumonia.
So, how does it impact them? Are they tired all the time?
Yeah, and that's one of the key symptoms is, they're very limited in their activities. And really, the different symptoms impact them differently. For example, when they have shortness of breath, they become more and more inactive, and this inactivity makes them deconditioned, which makes them more inactive, of course. So this relates and kind of turns into a vicious cycle. Shortness of breath, inactivity, and deconditioning. The cough and sputum is, of course, very irritating, and it's very serious for them. And really this, also sometimes is a social issue as well. I mean, not to really get off track, but, being in such a social climate, it really affects them. But anyway, the sputum itself, of course, bothers them. They feel it in the chest, in the airways, and essentially, this can contribute once again to shortness of breath and chest discomfort.
So, Dr. Saab, what currently do they have to help them?
Well, the most important thing, and I'm glad that you've mentioned this, is really to quit smoking. Smoking is really the key factor or the cornerstone in COPD because, as you know, emphysema is one of the key factors of COPD. But many times the disease gets established or they have difficulty quitting, clearly. And then, we do have medications, of course, that they can become very responsive to. Mainly, this falls into two categories. We have bronchodilators and we have anti-inflammatories. Bronchodilators really help to open up the airways, helps them breathe better. The anti-inflammatories also help with the breathing, cough, and sputum, but they also help with the reducing of the exacerbation episodes, I should say. All of these medications do reduce exacerbation episodes, but none of these drugs directly attack the mucus. In order to help directly in terms of clearing the airways and making them free to breathe again.
Yeah. So, what are the dangers of having that kind of mucus sit inside the lungs?
Yeah, very important question. And I think the danger really comes with, the discomfort of having it. You have some blockage in the airways. It's going to contribute to the shortness of breath, the sensations in the chest, the discomfort. Then, of course, the other danger is that the mucus basically forms a pool. A little amount of mucus is normal. We want that. It helps us to kind of, keep things in check, I should say. But we don't cough normally because we have these cilia in our lungs, and these really keep our airway clear, which is nice. They're thread-like. Everybody has them. But if we don't cough normally on a daily basis, then the amount of mucus is quite small. It's very thin layer. When people develop COPD, they have more mucus. It changes viscosity, and its ability to really clear out the lungs is stagnated. And that becomes much more difficult. It really, if you look at it in terms of, we start off with small mucus. If we're unable to clear it, we get a larger mucus, and it sticks. It just sits there. So a small amount of mucus is good. It protects us from infection. But if you have abnormal mucus in excess, you're more likely to get infections as well.
Well, thanks again, Dr. Saab. It's always a pleasure having you on our show.
Thank you. The pleasure was mine.
Hi, my name is Amandeep. I'm your nurse for today. How are you?
No good.
You have problem in breathing?
Yeah.
Okay. I'm going to ask you some questions to gather some information regarding your disease condition. Are
Okay.
you okay with it?
Yeah.
From how long do you have trouble breathing?
About 6 months now. Excuse me.
And is there a complaint of fatigue or shortness of breath?
Yeah. I used to work out. Now every time I do, it just hurt.
Okay. And is there any sleeping habits which are affected due to this condition?
Yeah. Actually, I sleep. I have this whistling or whizzing present.
Okay. And do you smoke?
Oh yeah, I'm a heavy smoker.
Okay. Thank you. I collect your information and will continue your nursing plan. And I hope you will feel better.
Thank you so much.
Thank you.
All right.
So the nursing diagnosis of this patient suffering with COPD are ineffective airway clearance related to ineffective cough and increased sputum production. And the second is anxiety related to threat to self-concept and unmet needs. And the third is activity intolerance related to intolerance within the supply of the oxygen demand. So the nursing intervention of this patient suffering with COPD are increase fluid intake to 3000 milliliter per day according to the tolerance of the heart of the patient. And the second is we should administer bronchodilators such as beta agonists and albuterol as ordered by the physician. And the third is we should assess the patient for comfortable position such as we should raise the head of the bed. And the ultimate goal is to maintain a patent airway and breathe sounds clear.
COPD is a series of diseases that blocks airflow to the lungs, making it increasingly difficult to breathe. COPD is frequently linked to emphysema and chronic asthmatic bronchitis. Studies show it is the third leading cause of death in the U.S. COPD develops slowly. Know the signs and symptoms, the cause of flare-ups, and the need to report changes. Symptoms often worsen over time and can limit your ability to do routine activities. Damage to the airways and lungs cannot be reversed, and there is no cure yet. But in addition to quitting smoking, making lifestyle changes, and staying more active, COPD can be controlled and further damage minimized.